Hello everyone, I am Dr. Umar Kararan. Today I would like to share some aspects regarding a certain condition, a peculiar condition called carpal tunnel syndrome. Let me hope this will be effective and fruitful for all of us. So this is a very common condition where one particular nerve called a median nerve is entrapped here somewhere in the canal called the carpal tunnel, because all the movements of the hands are through the particular muscle here called the flexor muscles. So all the tendons, nearly 9 tendons are going through a small area, that is a carpal tunnel, and on top of, in between, there is a small nerve called a median nerve. This can get compressed, especially if the person is repetitively using that particular hand for while doing work with the machineries, household activities, musicians, typewriting, using computers, and excessive use of mouse and other things, or any job or maneuver where there is a excessive usage of the hands. So this results in the irritation as well as compression and decreased space in the tunnel, which would result in a particular condition called carpal tunnel syndrome. So usually these people they complain of numbness, tingling, paresthesia and pain of this 1, 2, 3 and 4, sometimes in the 5th digit also, and this usually especially after holding mobile phone for few seconds or minutes, or while holding onto something, while working in the kitchen or cutting vegetables and fish. These people go on getting this numbness and pain, and they have to flick. It's called a flick sign. All right. And also they get up at night with a severe excruciating pain and numbness and paresthesia, which would go up all the way to the shoulder, and will disturb their sleep, and they get up and they have to go on rubbing, shaking or flicking. So what are the various conditions? Where do you get this thing? Normally there's no cause found in most of the cases, because it is quite common. Maybe around 5 to 10% of the population suffers this condition called carpal tunnel syndrome. It is especially common in females, especially the age of 30 to 50 years, and those who work excessively with the hands. Diabetics are prone for this condition. Diabetes mellitus, those people with thyroid problems, those with other hormone problems like acromegaly, amyloidosis, or who are pregnant, or actually those who are quite obese, where there's a excessive rounding of the wrist, so that the canal gets narrower. So once the canal is narrower, the nerves gets compressed very fast, especially while doing small activities, maybe just flexing for a few seconds or minutes, or extending, or maybe while holding on to something. So any maneuver like this prayer for 30 to 45 seconds, or maybe this doing like this, or maybe just stretching the fingers like this, or even after holding this wrist for 30 seconds or more. Some people complain of the numbness and paresthesia after trying the BP apparatus here. So any of this maneuver which should decrease the space, or there will maybe some excessive usage of hands or something, which would result in a severe excruciating pain and paresthesia. So what will happen if you don't understand this? The end result is that you would lose the sensation of the fingertips and this part, all the fingers except this area, because this area is getting supply from higher head. So they might feel that they don't know where they have grasp, or especially while taking out the vessel from the kitchen and all, they tend to drop all the objects because they don't feel where they have kept their fingers, things like that. So this is very common. Secondly, they tend to develop some wasting of this particular area. It's called APB, abductor pollicis brevis wasting, and would result in difficulty in buttering shirts, or opening or closing the bottles or something like that. So those are the results, so that the person may not be able to do like this, because this is the most important action of humans compared to apes. So once you find that you can move this, then there is a condition called ape thumb or something. This is not able to move in this 90 degree. So how to diagnose this condition? The most important thing is history. The history is that patients or the person complain with this pain, tingling and numbness and paresthesia, especially while doing some activities, and this would spread all the way up and tend to be better with the shaking, rubbing or flicking. Second thing is you can do a condition called nerve conduction study, where there is some changes in the amplitude and the conduction velocity and distal latency. It's called a nerve conduction study. And you just compare with the other side, with the other nerves. There are motor studies, sensory studies and things like that. Then you can also do an ultrasound scan, which would find that the nerve gets flattened. So once you find this, you can do a conservative treatment like doing some exercise, wrist this sort of exercise, reduce your weight, control your blood sugar, blood pressure, thyroid has to be treated, and if any other problem like the problem with the rheumatoid problem, you have to treat with steroids or some other medication, depending on the condition. And if the canal is quite narrow, normally it's 2.5, so once it is overcrowded, probably you can do a injection, local steroid injection into the carpal tunnel, maybe directly or with the help of an ultrasound. If this fails, then of course we can go for a decompression of the carpal tunnel, either by a direct opening or through an endoscope. So it's always better that you diagnose by yourself, because if we can't hold this position for 30 seconds or longer, and if you get the similar set of symptoms, always think that you may be having a carpal tunnel syndrome. Of course, similar condition can, because numbness doesn't always mean it's a carpal tunnel, because any problem in the nerves, like if the nerve is blocked here, or if the nerve is blocked high up in the axilla or in the root, can also give us to the symptom. But the classical symptoms of pain, numbness and paresthesia, especially while holding something for a few seconds or minutes, improved by this sort of thing. And if it's a disc problem, usually this gets worse by coughing, sneezing or any strain. Secondly, the nerve condition will be of that, it will be different, and the examination finding is also different. Yeah. So I would like to share these details with you on carpal tunnel syndrome. Thank you very much.